Anish, we're unfortunately running short on time. We'll come back to you. For now, viewers, let's move ahead. Now, border tracking systems are facing immediate upgrades across key transport terminals following medical scare in Bengaluru and Ahmedabad. Strict surveillance protocols have taken effect after 2 travelers displayed viral hemorrhagic indicators, prompted sudden medical intervention. Medical teams swiftly isolated a 37-year-old individual, Amuri Lokula, inside a specialized ward at Ahmedabad Civil Hospital after tracing his transit path across the African continent and Bangladesh. Meanwhile, a secondary scare involving a Ugandan citizen in Bengaluru concluded safely when her diagnostic tests returned clean. Doctors emphasize that early quarantine remains the most effective tool to stop lethal pathogen transmission inside high-density urban populations. Let's go to my correspondent Atul Ranjan on this. Atul.
Several of suspected cases have definitely sent alarm bells ringing here in India, but so far so good. There haven't been any confirmed cases as of now of Ebola. But as I said, at least 3-4 cases. One of course the first case, or suspected case rather, of a Ugandan woman who arrived in Bengaluru. Her report, importantly, significantly has come negative. So that's a sigh of relief for that thing. But at least 3 people in Ahmedabad. Ahmedabad has been, found suspected of the Ebola case, particularly one person who has displayed symptoms of, fever, cough, and headache and stuff, which are typical symptoms that are associated with Ebola. That person has been significantly, isolated at a civil hospital there. So, and obviously a Nagpur case as well, a Nagpur case where a 47-year-old man has also been, who has history of travels of the same hotspot regions in Africa where the Ebola has spreading, the outbreak is going on. That same person has also been isolated in Nagpur. So clearly, India is quite alert when it comes to tracing and people who have travel history to the affected region in Africa, and the government has been quite proactively, dealing with in terms of screening and isolation. We saw a couple of days ago, Union Health Minister J.P. Nadda conducting a meeting with officials and taking a stock of the situation and the preparedness for the same. We saw IMA, Indian Medical Association, launching an advisory for all its state and regional, units to stay prepared for Ebola and be alert on in terms of identifying any sort of symptoms associated with that. Yeah.
All right. Thank you, Atul, for joining us on that. And with that, viewers, we are taking a very small break. We'll be back. Stay tuned.